Welcome everyone to starting the menopause conversation at work. If you don't know me, my name is Melanie White and I'm the co-CEO of Sage Women's Health. We're really excited to be presenting two fantastic guests today, Memphis Bourne Blue from the New South Wales Premier's Cabinet and Professor Kathleen Riach, I think I've got that right, from the University of Glasgow. And we're here today because we know that menopause is a significant issue for individuals and businesses. A recent survey in 2021 from the Victorian Women's Trust showed that 83% of women were experiencing at least one menopausal symptom that was disrupting their work. So that's significant. And more recent studies have shown that up to a quarter of women around midlife are resigning on an average of 7 years early. So there's seriously an issue for women, but there are also business impacts when you consider that early resignation. We know that the quantifiable cost of somebody resigning is that you're going to have to pay 2 times, perhaps up to 6 times their salary to replace them. And we also know from a recent study, done by Griffith University, that Australian businesses are spending around $10 billion a year in replacement costs alone for those resignations. Now, that's a significant issue. What we don't know enough about, what hasn't been quantified, is the flow-on effect of those resignations. So consider that a senior female leader leaves because of menopause. Some other staff in the organisation might also choose to leave. There might be the loss of IP and wisdom from a company, from somebody who's been working there for so many years. And of course, all of the clients or stakeholders that that person has been engaged with might follow that person or leave the company that they've been served by. It's a big complex issue, and it's no wonder that companies are now starting to wonder, what should we do about this? How do we do it? And what's the easiest way to tackle it? A lot of women don't necessarily want to talk about menopause, and 2/3 are too embarrassed to ask for support. And that's why we're here today. We're here to hear from Memphis about the New South Wales Government's Perimenopause and Menopause Toolkit initiative, and from Professor Kat Riach from Glasgow University on some of the latest research and a simple approach to doing something in your organisation to start the conversation. Before I introduce our panel, I'll briefly introduce Sage Women's Health. We are an organisation of 18 highly experienced professionals located across Australia, and our goal is to keep women well and at work. Our united vision is to help women to step into leadership roles, to help companies to maintain their impact and their brand, and for employees to live a happy and purposeful life. And we do this by helping organisations to implement policies, initiatives, and programs that keep women well and at work. Now let's meet our presenters. I've just introduced myself, and I'd like to also introduce Memphis Bourne Blue, Associate Women in New South Wales Premier's Department. And she has, before joining the public service, worked at the Prime Minister's Department and Cabinet, and also worked for a not-for-profit in Western Sydney in their anti-racism and anti-Islamophobia campaigns, and she was leading those campaigns. So she's very across discrimination at work and has been part of this project from the government. Professor Kathleen Riach, I'll get the pronunciation right, is a professor at the Annum Business School at the University of Glasgow, and she's also an honorary professor at the Monash Centre for Health Research and Implementation. She's an international authority on ageing and organisations and has undertaken research on gendered ageism and gendered experiences of discrimination, health and wellbeing across the working life, all funded by a variety of research council. She's also widely published. She's led the development of the Menopause Information Pack for organisations, which we'll hear more about later today. And that's been downloaded over 13,000 times by over 52 countries. And today we'll also hear about Kat's recently published research with a study of 6,000 NHS Scotland employees. So without further ado, I'm going to introduce firstly our agenda for today. Memphis will start talking about the Women New South Wales Menopause Awareness Campaign and the toolkit and resources, and we'll have a quick Q&A. Then we'll talk to Kat, Why now? Why should we address menopause now? We'll talk about menopause at work and some of the research, and we'll talk about the information pack and the MIPO approach, followed by a Q&A. Then we'll have some final questions and a wrap up and next steps. There's nothing for sale in this webinar, but we are going to be talking about the next one that we'll be running, which will be on financial wellbeing at the end of November, early December. So without further ado, I'm going to hand over to Memphis. Memphis, thank you. And I'm here to turn the slides over for you and to host any questions in the chat box. Please do type a question in the chat box if you have anything to ask, and we'll save them up for the Q&A at the end.
Thank you very much, Melanie. Thanks, everyone. Melanie's already introduced me, so I don't need to do that. But so Women New South Wales sits within the New South Wales Premier's Department. And so our work focuses on improving outcomes for women and girls across New South Wales. And a lot of our work is guided by the New South Wales Women's Strategy, which is a whole of government, whole of community policy framework, and it looks to improve the economic, social and physical well-being of women and girls across New South Wales. Next slide, please, Melanie. Thank you. So Women New South Wales is responsible for leading and developing the New South Wales Menopause Awareness Campaign. So this is focused on perimenopause and menopause, obviously, and the campaign was launched on World Menopause Day last year. It has three focuses that I'm going to dive into a little bit more. So we've got the community campaign, the general practitioner campaign, and the employer campaign. Next slide, please, Melanie. Thank you. Also, I forgot to remove that slide. So next slide. Thank you. So the centerpiece of the community-focused part of the campaign is the Menopause Toolkit, which is a hub of free, trusted resources that people can access to understand a bit more about symptoms and other forms of support. So it uses, this part of the campaign leverages the credibility of the New South Wales government so that people can find resources that they can trust. And so the reason we chose to do this is because in October 2022, we conducted focus group research with, I think it was about there was 5 groups of women and their partners from English-speaking, Chinese-speaking and Arabic-speaking backgrounds, as well as First Nations women. And what we found is that people were having a hard time finding information that they felt they could trust on the internet about symptoms of perimenopause and menopause. And so I pulled out some of the comments we had from those focus groups. And so it was like, it's not easy to find reliable information. That's the biggest issue. How do you determine what's good quality? And there's just not enough information anywhere. For example, when I go to the local doctor or see campaigns, there's a lot of information on things like breast cancer and sexual health, but never anything about menopause. And so on the Menopause Toolkit, we also have, in addition to the symptoms checklist that you can see there that I've included a screenshot of, which we have translated into 8 languages and an easy read version as well. We also have a series of podcasts about the major symptoms of menopause, because we know people like to consume information in very different ways. We also have other resources that I'll talk about later, but we have a fact sheet for partners and family members of people experiencing perimenopause and menopause, because we know we can provide people with all the information we want about their symptoms, but those around them also need to have understanding of what they're going through. And so in the 2-week period following World Menopause Day this year, the toolkit had more than 16,000 hits, which was a 2,000% increase from last year. So we're really, really happy with people visiting the toolkit. And I'll include a plug for going to visit the toolkit at the end of my presentation. But we're really looking to make sure that people can go to the toolkit and find the information that they need to understand their symptoms. So next 2 slides, please, Melanie. Thank you. So we also held, as the second part of the campaign, there's a GP focused element. So we held on World Menopause Day a webinar for general practitioners, which dived into 2 case studies on menopause. And it was very, very technical, very medical information, but it was just to provide general practitioners with an opportunity to deepen their understanding of menopause. And so this was an accredited activity with the Royal Australian College of General Practitioners. And we had Dr. Karen Maygraith, I think her surname is, the president of the Australasian Menopause Society, and Dr. Sonia Davidson, an endocrinologist, as the presenters for this webinar. We had about 300 people register, which was fantastic, 300 general practitioners and health practitioners, and the recording of that is available on the Australasian Menopause Society's website. Next slide, please, Melanie. And one more, thank you. So obviously today is much more about menopause and its impacts in the workplace. So I think Melanie touched on this before, but we know that because women on average retire 7 years earlier than men, there is a whole lot of lost income and superannuation. And so the Australian, sorry, I thought someone was trying to come into my room. The Australian Institute of Superannuation Trustees has estimated that this costs women in Australia about $17 billion every year. And apparently that's quite a conservative estimate. So that is an insane amount of money that would impact women's financial security in the long run. And so research indicates, I'm sure Professor Kathleen will touch on later, but research indicates that while women may not want to draw attention to the health impacts of perimenopause and menopause, they do make decisions that impact their employment because of those symptoms. So things like not seeking promotions, taking more sick leave than previously, reducing their engagement with their work, and a much higher intention to quit work. Next slide, please, Melanie. So to support women and their managers in understanding menopause at work, we have developed, the New South Wales government's developed a range of resources focused on the New South Wales public sector. So we've got an employee fact sheet and a manager fact sheet, and I'll include a screenshot of that on the next slide, but those are intended as kind of conversation starters and guides for people so they can sort of understand, for example, from a manager's perspective, like what is menopause, who experiences it, how can I provide support, and how do I have an appropriate conversation about that? So obviously we did design that with the New South Wales public sector in mind, but we think that there's quite a lot of adaptable principles from those fact sheets that can be used in other workplaces as well. So those are available on the Menopause in the Workplace page in the toolkit. And next slide, Melanie. Thank you. And so there I've included a screenshot from a webinar that we held on the 18th of May this year. So this was a webinar called Working with Menopause, and it included leaders from across the public sector and people who had lived experience, and also included someone from Jean House for Women's Health, who obviously has done a lot of research in this space on the impacts of menopause on women. And so this webinar was intended to support managers and employees in talking about and asking for support where they needed to for menopause in the workplace. So we had about 1,100 people from across the New South Wales public sector register, which was fantastic for this webinar, and more than 800 people watched live. Which was really great. We got some fantastic feedback. So I can read some of that feedback because I think it was really interesting to see what the questions people asked during the webinar and what people needed. So we saw that public sector employees wanted more detailed information about the symptoms of perimenopause and menopause. And so comments also reflected that people felt the need to increase awareness of menopause in the workplace. So some of these were, there's a lot of women in the workplace who have symptoms like me. I feel like I'm not alone anymore. I got a lot of great information and insights from this webinar that'll help me in my day-to-day life, especially when it comes to working in menopause. I feel like I had very limited information in this area, and this webinar gave me ways to find further information and empowered me to support people in this situation and the confidence to offer support and care. And finally, I didn't realize that so many other women I work with were going through the same. And then they go, silly, really? But it opened my eyes. I've definitely learned to be more empathetic and more open about it. So some of the other feedback we received is that the webinar kind of sparked conversations within teams about what people were experiencing, whether they were women-dominated teams or relatively gender balanced. And a lot of people said that they sent the recording of this webinar to their manager and was like, I'd like to have a conversation. Here's something to get you up to speed. And I'd like to talk about the supports that I need. So that was really fantastic to see. And next to that screenshot, I've included one of the fact sheets that we've developed. So again, developed for the public sector, but they can be adapted to other workplaces. And these have been downloaded, both fact sheets have been downloaded about, just doing some maths here, I think about 800 or 700 times since they've been launched, which is just fantastic. Next slide, please, Melanie. And so we do have links to other resources on the toolkit, so some health-specific resources, and the menopause information pack for organisations is also linked on the toolkit, because we want people to be able to see the resources that New South Wales Government has developed, but acknowledge that the conversation is so much bigger than what we've had time to work on, and directing people to further information should they need it. Next slide, please, Melanie. So thank you very much, everyone. Please check out the Menopause Toolkit. Please use the resources, adapt them, and please get in contact if you have any feedback on the toolkit or any suggestions. Thanks.
Thanks, Memphis. That was fantastic. And we'll see if anyone here has any questions, please pop them in the chat box. And I have a couple of questions for you, if that's okay.
Absolutely.
How has the team you're working with grown since this initiative started?
I think when the menopause awareness campaign started, we started engaging a lot with specialist areas in health more to make sure that we were testing any of the resources we developed with people who have lived experience or who are currently experiencing perimenopause and menopause. And so the campaign and the team kind of grew in a sense because we made sure that we could elevate that lived experience in any of the resources that we developed, and so that they worked for the people that they were intended for, I would say.
Okay, fantastic. And how has the toolkit been used internally within the New South Wales Government?
So for World Menopause Day, we did a really big internal push of the toolkit, and we saw that a lot of people were sharing this. Like, for example, the Department of Education shared it, Services New South Wales shared it, and it seems like, obviously we haven't been able to necessarily quantify that, unfortunately, but it seems like it sparked a lot of conversations. From the feedback we get direct to the Women New South Wales inbox, it seems like sharing these resources internally on World Menopause Day sparked a lot of conversations between employees and managers.
That's fantastic. It's all about awareness and understanding to create that sense of compassion and empathy, isn't it?
Absolutely.
Yeah. And what's next for you with this, or for the government, in terms of supporting menopause awareness?
So from the GP webinar, we're looking at developing a text-based resource for general practitioners to sort of fill any knowledge gaps that were identified during that webinar. So we're working with the Australasian Menopause Society and the Agency for Clinical Innovation, which is part of New South Wales Health, to create that resource. So we're just looking at strengthening the toolkit and making sure that the language is also appropriate, given that, a diverse range of people experience menopause. It's obviously trans men and non-binary people can also experience menopause, so we want to make sure that everyone can be included via these resources as well.
Fantastic. And I'm just checking the chat box, and Nadine says, I've worked in health in Vic for 15 years, and apart from a few women joking about hot flushes, there was never any conversation about menopause. So great to open it up. Thanks, Nadine. And Tracy has said, you mentioned that there was a survey that showed people wanted information on menopause they could trust. How many people did you survey?
So that was from our focus group research. So that included 5 groups of women and their partners, or people experiencing perimenopause and menopause and their partners. And so I think there was probably about, I'd have to look up how many people that was, but maybe like 30 people in that group who indicated those things. So that was conducted in October 2022, that focus group research.
Okay, fantastic. And can you talk a little bit about how this toolkit aligns with this National Strategy for Women's Health 2020 to 2030?
I think the National Strategy for Women's Health is obviously a federal government initiative, and I know that the federal government's putting a lot of focus on menopause now, especially with the National Women's Health Advisory Council. So hopefully these resources can be shared beyond New South Wales, because they are intended as to be accessible for everyone. And also, hopefully, like with time, we can continue to strengthen, especially the language on the toolkit.
Okay, thanks, Memphis. Is there any last thought or comment before we pass over to Kat? No? And hopefully we can get some links across to everyone for the toolkit and other resources that have been mentioned today. And Memphis, if anyone wants to give feedback on the toolkit, what's the best way to do that?
That would be to, I think there's a contact us function on the toolkit, but also to email Women New South Wales. I'll put it in the chat, but Women New South Wales' email if you have any feedback or any thoughts about the toolkit as well. Thanks, everyone.
Awesome. Thank you. I'll pass over to Kat now. Kat, excited to hear from you now. And I'll put myself on mute, and please just say next when you'd like me to move the slides.
Perfect. Okay. So thanks so much for inviting me over, and thanks to Memphis, because I think what she's talking about very much chimes with what we found in terms of best practice and best evidence over the past 10 years when we've been engaging with research surrounding menopause at work. So if we could just go to the next slide. So I thought it would be useful to kind of, as I said, you know, the past 10 years I've been researching menopause at work. I've been looking at women in gender and aging in the workforce for around 20 years. And what we've kind of found is exactly what Memphis said. You know, it's always been there. Women have always been in the workplace. They've always been working, but it's only really been recently that it started to become something that's in the public ether, or what we would call the public imagination, if we're kind of, for social scientists speak. So why now has this happened? Well, there's a number of kind of reasons why there's been this tsunami of interest and awareness surrounding menopause at work. I was based in Australia for around 6.5 years, and I've more recently been based in the UK. And whilst the UK is further forward, what we notice is particularly around the global north in the world, there has been an increased focus. So we've seen you know, awareness campaigns such as those run by ARI, the Australian Human Resource Institute. We've seen a number of tribunal cases, employment tribunal cases in the UK, where menopause has been mentioned, and there's been an ongoing discussion around how we understand menopause or menopausal symptoms as being part of a protected characteristic. And more recently, there's been a real wave of interest from the US coming through. So we've had, you know, high-profile speakers such as Michelle Obama talking about menopause. We've had kind of New York Times features discussing menopause. We've had a kind of Times billboard looking at menopause. And I think what all this signals is that, you know, kind of there's almost this Pandora's box effect about menopause. Once people start talking about it, it's very hard not to ignore it. But as Memphis really discussed there, we're almost kind of lagging behind in terms of accurate information and evidence. And that's evidence in terms of what we know works best surrounding supporting menopausal women in the workplace, supporting those around them to support them in the workplace, such as line managers, but also making sure that the information that people have is accurate when they're either going to their line manager or they're going to their healthcare provider in order to support them staying in or participating in employment. Next slide, please, Mel. Oh, great. So I thought it'd be useful to kind of give a purview of why it's important. And I think Melanie and Memphis have already discussed this, but I think it's important to remember that, you know, economic insecurity equals menopausal insecurity in a number of ways. And what we know is that menopausal transition usually happens around 51 years of age. For some minority ethnic groups, it can be earlier, and for other women, it can be you know, before the age of 40 as well. We also know that you have different kinds of menopause, such as, you know, surgically induced menopause, and that can be due to hysterectomies or oophorectomies or cancer treatments, and medicines can actually generate a cliff edge menopause. So there's all these different aspects of menopause, but what's really important to remember is that it usually happens at a time of life where women are becoming or maybe becoming financially insecure or economically insecure in some ways. So, for example, we know that all other things being equal, women are around 3 to 4% more likely to be at risk of poverty. But we also know that whilst this has been rising for the past 5 years, it's usually measured at that household level. So we actually have a lot of hiding of what women's economic vulnerability is in society. We do know, however, that Lone parents are more at risk of poverty, and around 4 in 10 lone parents across the life course are at risk of poverty, and they are mainly women as well. And so what we see is menopausal insecurity happens in a broader biographical crossroads when other things are happening. That includes what we call the leaky pipe, so where we see particularly between 35 and 44 women either leaving the labour market or being employed in a part-time basis, or not going for those promotions, as Memphis emphasised. We also know that women are disproportionately located in less powerful jobs, less secure labour market positions. So we know a majority of women work in healthcare, health and social care and education as well. In Australia, women over 55 are the fastest growing group of homelessness. We know that that's not stereotypical homelessness, it's what we call hidden homelessness. So women who may be staying with friends, women who may be kind of staying on people's couches and kind of precarious accommodation. And that affects an access to a quality of life, healthcare, and how they can access healthcare support for menopausal symptoms. And then finally, we have aspects such as silver splitters. So we know that since around, I would say 1990, at the start of the 90s, we've seen a huge rise of what's called silver splitters. That's later life divorce. That's risen by about 64% since around the early 1990s. And that has huge implications, because what we know is during divorce settlements, women are probably more likely to want to keep the house and forgo pension rights that they have with their partners. And that can result in later life financial insecurity. And whilst we know in terms of those divorce settlements, whilst around 61% will seek advice from lawyers, only 3% will seek advice from financial advisors. So this whole kind of setting means it's really, really important that women are able to work productively, work well, and work to secure their financial futures, both short and long term during menopause. Next slide, please. At the same time, we know that menopause happens in terms of a life course approach to what we call gendered ageism. And gendered ageism is really when we have an effect of age-based bias and gender-based bias coming together. And unfortunately, we know that this affects women right across their lives. So I've given a kind of example of these stereotypical aspects that manifest in terms of gendered ageism, where we have women at the start of their careers being blighted or expected to be blighted by the perfection principle, so kind of paralysed into making the wrong decision, focusing on that kind of 2% they got wrong rather than the 98% they got right. They then move into a kind of stereotype of what we call the +1 syndrome, where they're kind of seen as being, obsessed with having a partner, a kind of normative lifestyle of, marrying someone and having babies. They then move on to what's seen as a care-orientated accommodation. So not really focusing on their careers. Again, this is stereotypes. Not really focusing on their careers, but focusing on caring either for younger children or older family. And we know that, women disproportionately take the burden of looking after elderly parents, even when they're not their parents. So that's a really important aspect. And then finally, we've got around about, the average menopausal age, women are culturally either become invisible or they become hyper visible and problematic. And a lot of menopausal stereotypes feed into these ideas of them being, these cranky old women. So these are the kind of things that women are having to contend with. So next slide, please. So that's kind of what we know where menopause sits in terms of, broader economic and social mores and expectations and stereotypes. But what are some of the things that affect working women? Well, this is we've done a number of studies, a number of surveys and interviews and focus groups with a variety of women. I thought this would be useful to put up because this was based on women in the Australian education sector. And this is a study that looked at what were their menopausal symptoms. And I think the most important thing there is to note that actually, the kind of hot flush that we see as being synonymous with menopause wasn't necessarily the most disruptive to working women. What was most disruptive was sleep disturbances, you know, in other words, an inability to get a good night's sleep, and that had a huge impact on their working lives. But also things that can be exacerbated by the workplace, such as, you know, pain in bone joints and anxiety. You know, we know that these are things that can be heavily influenced by the work environment. At the same time, and if we could go to the next slide, at the same time, what we see is that menopause, whilst it is something that all women and people who menstruate will go through, it is not necessarily a homogeneous experience. And this is where we start having seeing challenges for workers and also line managers and organisations in trying to support it, because what we want is an inclusive approach, but not one that homogenises the experience. And I've put up these kind of quotations again from some research we did. These are from in-depth interviews in Australia. And what you should see here is a variety of experiences. So people like Valerie saying, you know, I breezed through it. This is the menopause that I guess we all want. You know, didn't have a problem, didn't even need to go and see the doctor. By comparison, we had people like Hannah, who had significant flooding, so bleeding in terms of her perimenopause, where she had to, you know, be careful about what clothes she wore when she was able to change them, especially if she was traveling for work, for example. We have people such as Abby, who said, you know, it's kind of a repressive experience, so she suppresses those experiences. And then we have people like Diana, who say, you know, it is inconvenient, it is annoying, but actually it's part of a broader period of life where, you know, I'm becoming more myself than ever. And, you know, it just becomes a bit like, you know, it feels really liberating as part of that broader time of life that they're going into. Next slide, please. So what I thought I would do now is introduce kind of two resources that we've developed that are kind of evidence-based, based on academic evidence that we've been working on for the past decade. And this is MIPO and MAPLE. Next slide, please. So MIPO, as Memphis mentioned, and thanks for the link there, Memphis. MIPO stands for Menopause Information Pack Online, and we launched this. It's an evidence-based resource. We launched it in 2019 as a free open access resource. And one of the reasons we launched it was partly because we noticed that there was some misinformation happening in the market, saying, you know, this is what you should do for your menopausal employees, that was actually contradicting what we'd actually found in our studies. But also we wanted to give line managers a resource, because we knew from research that they were the really important ones that could make a difference between women feeling welcome in the workplace and their symptoms as being, you know, possible to work through, or seeing it as a problem in some way. So this resource was particularly focused on line managers and supervisors. It was open access, so companies and companies it's still available. Companies can, you know, pick it up, rebrand it, and as long as they kind of mention it's come from us, they can use it. Okay, so it's a non-commercial open access license. I also wanted to mention there are other guidelines also available that are good. These are some of them. So I was involved in the British Standards Institute putting together some guidelines that were launched this year. There's Hot Resignation, which is US based. Again, I was on the advisory group for that. ACAS have put together a toolkit. The CIPD, which is the equivalent of the Australian Human Resource Institute for professional human resource professionals, and also the European Menopause and Andropause Society have put together some resources as well. So there's a number of resources out there, and the message I want to give here is that, you know, if you're thinking of how you can support menopause in the workplace, you're not starting from a blank slate. There's a number of resources that you can draw on, that you can use there to help you start those that kind of policy and practice work. So MIPO is being downloaded, I think that's a figure from last year, it's been downloaded a lot across 52 countries, which is fantastic. And we're also looking to support small to medium enterprises, particularly because it is open access and we know that there are resource issues there. But we also know that SMEs contribute up to 50% of GDP across OECD countries, and around 70% of employment worldwide is micro and small enterprises. So we want to make sure that when we're putting together these resources, we're very mindful of not just those kind of large organisations, large corporates or large public sector organisations, but other organisations that might just have a few employers that really would value kind of an infrastructure and policy that they can lift in and put into their own practices. So that's MIPO. Maple is hot off the press, so it was launched nationally last week, and MIPO is based on what we've called the AMINO study, which is, again, you can see that obviously I love acronyms, and the AMINO study is advancing menopause and menstrual health in organisations, and that was a study of over 6,000 employees across NHS Scotland, so the National Health Service in the UK, looking at menopause and menstrual health at work. And the recommendations of that study have directly informed a new NHS Scotland policy, so a national-wide policy looking at menopause and menstrual health at work, which was also launched last week. And I thought I'd go into detail just in the remaining time very, very quickly to look at what MAPLE is. And what we've tried to do with the AMINO study is come up with a very quick acronym that shows that, you know, it's never too late to start thinking about menopause in the workplace, but it's never too early to also revisit your policies and practices as well. So I'm going to go through the acronym of MAPLE just to touch upon some points that are really important in terms of thinking about workplaces and menopause positive practices. So the first one stands for micro accommodations. And what are micro accommodations? Well, micro accommodations are basically low resource but high impact solutions. So these are things that aren't going to change the infrastructure of how you work. They're not going to cost a lot of money, but they have a significant impact. Excuse me. This can be, for example, splitting up breaks. So giving people the opportunity, rather than take 1 hour, they're allowed to take 1/2 hour and 2 50-minute breaks. So they're able to stand around if they have joint pains, if they have kind of anxiety, if they just need to kind of get away from the screen, you do aspects, you kind of split up those breaks. Other kind of micro accommodations can include short time off to prevent a full day's absence. Now that's a really interesting one, because what we found in the study is that, you know, if you're able to give people off an extra 15 minutes, for example, to, you know, attend to a heavy bleed or change their uniform or change their work outfit, they're more likely to attend. And that's really important in public services such as healthcare, because what it is the difference between someone coming into work to do a full shift and someone not coming in to do a full shift because they feel that their menopausal symptoms aren't supported in the workplace. So that's really important as well. But micro accommodations are also about the ability and the speed of quick fixes. And the big example we give there is always how to access a fan. So this is from our research where we had in the same organisation someone who was having hot flushes. They asked their manager for a fan. Next day, it was on their desk, no questions asked. Someone else asked for a fan and they had to fill out three pieces of paperwork, wait 3 months and get sign off from 2 people, therefore disclosing why they wanted that fan. And the question is, you know, both people ended up with a fan, but who do you think felt most included and motivated and engaged with work? I think it's, you know, it's answers on a postcard. It's a pretty easy answer. So I think it's about making sure that the quick fixes, women are able to access those quick fixes without any problems. So that's M for micro accommodations. So if we move on to the next slide, A is for allyship. Now, allyship's not just about kind of championing menopause in terms of World Menopause Day or International Women's Day, but making sure that there's allyship in terms of ensuring that structures are in place in the organisation where people can disclose in a safe manner to individuals, even if there is a power dynamic involved in that relationship. So that can include, for example, providing routes for disclosing menopausal symptoms and possible accommodations that are kept separate to performance management processes. And we've worked in organisations where they've said, of course, people can disclose it. You know, we always ask a question if they want to disclose any health and well-being episodes once a year. And we ask them when they do it, they're like, oh, in the annual performance review. You know, when people are having an annual performance review, it's not likely that they're going to disclose something that makes them feel slightly vulnerable. Allyship's also about recognising that there's an importance around work stress overload, but also stigma and perceived job autonomy as well. So, you know, making sure that we're trying to tackle these things that are perhaps more insidious in the culture that make people feel unwelcome or having to suppress their symptoms. And if we go into the next page, I'll give you some kind of a quick overview of stats that come out directly from the Amino study. This was the study of over 6,000 employees that I mentioned. So for those that were experiencing what we call disruptive menopausal symptoms at work, and by disruptive menopausal symptoms, what we mean is how women would define that as making you have to make some changes to how you would normally do work. Okay, so you have to change something about your business as usual approach to your workplace. And what we found there was around 3/4 of women ignored them, so tried to suppress those symptoms. But over a fifth actually changed how they ate or drank at work. And that was really significant. You don't want a workforce who are dehydrated and not able to concentrate because of low blood sugar because they haven't eaten all day in order to try and manage their symptoms in some way. They're not going to be engaged. There may be even kind of risk implications for that in terms of concentration, for example. And overall, it's not healthy for your workforce. And working from home was a positive option for many employees. Although we've also got to remember that people who work from home might also not have the facilities that they need to do their job, or they may actually feel that increases their anxiety because they're not able to disclose how they're feeling on a virtual platform as opposed to a face-to-face interaction. Around 16% took some sick leave, but also we found that people were strategically using their annual leave in order to manage symptoms. So it may be that they were deliberately taking time off, of annual leave in order to kind of manage particular symptoms. And finally, we found around 38% took over-the-counter medicine, so ibuprofen or paracetamol. To help them continue working. That's fine if you can access that on shift, but if you work in particular occupations, you may not have access to these pain relief medicines. Okay, so let's move on to P. I'm aware of time. So P is physical environment. So physical environment is really thinking about those physical, practical aspects of work. That can include uniforms, what materials are uniforms made of. It can include workplace temperature. It can include ventilation, but it can also include the job design as well. So we know from some studies there are certain jobs that can aggravate symptoms, and we also know the availability of sanitary and washroom facilities is really important for women. In Scotland, we have free period products available for everyone, and that's been really important, not just for women or people who have periods, but also people who have menopausal bleeds that are unexpected, that they know that they will be able to access them wherever they go, and it won't be cost prohibitive. Moving on to L, if we go to the next slide. L is line management. And as I said, I think if there's one thing that I want you to take away from today is line management and supervisors make a significant difference, because they're usually the ones that employees will have the first conversation with, and they're the ones that signal whether it's going to not be an issue, it's something that they can work through positively and productively, or it's going to be a challenge for them, and they're not, they're going to get signals that they're not welcome in the workplace. So I think that line management responsibility is really important. At the same time, whilst we know that managers are really keen to engage with medical advice, they're really keen to have clear managerial guidelines. So make sure that your policies support not only women, but support line managers. And also, like HCPs, healthcare professionals, they recognise they can make a positive difference. At the same time, they know that sometimes it's hard for women to get medical evidence because of underdiagnosis, misdiagnosis, and late diagnosis surrounding the menopause. They know it's difficult to manage multiple health experiences that a number of women experience. So those going through menopause, probably around at least 13% of them are also going to have, for example, some other kind of health condition. And also, like healthcare professionals, line managers and supervisors are really, really busy. They have lots of demands. They're expected to do lots of things. They're usually not given enough time or resources to deal with them. And I think the key thing about line managers is we're not expecting line managers to be quiz experts on menopause. But what we're expecting them to be able to say is listen to people, listen to their employees, say, I might not know the answer just now, but I'll find out for you, and thanks for telling me, and I'm sure we can do something about it. And that is an affirming conversation in terms of menopausal conversations. I think if we just kind of switch to the slide after this one, to the E, if that's okay. Education for all, yeah, that's perfect. So education for all is the final letter of the acronym. And what we mean there is it's not just about educating women or educating line managers, it's making sure that everyone knows that this is something that women go through. It's probably not something they were taught about at school, and it's something that, you know, isn't necessarily something that makes women a terrible person to work with or a brilliant person to work with. It's just something that is unremarkable, something that women go through, and they can still make significant contributions to your team and to your organisation. At the same time, we know that around 40% of women have had a workplace experience that leaves them feeling embarrassed surrounding menopause. We know that the same amount usually can't find time to actually attend to their menopause at work. It's really busy. And then over half felt that they didn't have a way to formally disclose their menopause in some way. So picking up with the idea of disclosure that I talked about earlier on. So what are the kind of take-home messages from this, if we go to the next slide? Well, I think, as I said, it's never too late to start supporting. So don't think that, you know, if you've not done anything, you can start something today, and doesn't have to be a grand policy. It can just be about thinking about your policies, revisiting what your current practices are, and thinking how you can make them menopause sensitive. The second aspect is, as I said, there's a wealth of guidelines and tools out there, and they can support you. So there's no need to reinvent the wheel. There's things out there that you can do and you can adapt for your particular workplace in terms of the occupational or sector context. And then I think the final point that's really important to remember is that it's likely in your organisation that you have people, you have employees, you have a woman who know best what works for them. They know how organisations can support them through their menopause. Use that expertise and use that knowledge in your organisation. We're not saying that you have to out women and say, oh, you're menopausal, you must know, but open up those communication lines for them to tell you what they think menopausal women and menopausal employees will need in the workplace, and you'll already have that best practice evidence probably already happening in your workplace that you can build on. So I'll finish up there, and I'm happy to take any questions or comments.
Thanks so much, Kat. We'd love to see any questions in the chat box. That was really informative. And I think something that really stood out to me was the fact that there is still this shame and stigma, and what women really want is to be heard and supported, and they're feeling under-supported, and that stigma is holding them back, and there is this somewhat of a stiff upper lip approach. Keep calm and carry on.
I think you're absolutely right. I think the key thing to kind of that's important to take away is usually it's not actually the menopausal symptoms that stop women working. It's usually the culture surrounding them. It's usually often not able to access timely or accurate medical advice or healthcare advice that will help support them staying in the workplace. And it's also just not knowing what's happening to them, or others not knowing what's happening to them. So often it's the symptoms are the least of the challenges that are actually pushing women out the workforce. It's the kind of aspects and dynamics that oscillate around menopause as a cultural or social issue.
Absolutely. In fact, I was talking to someone last week who said that in her workplace, which was female dominated, the younger women in her organisation would talk about those cranky old menopausal women, and she felt bullied and challenged from her own female younger colleagues, which I thought was really interesting. Has there been much of that in the research that you've seen of women perhaps not understanding and making judgments about other women?
Yeah, I mean, look, I'm always really kind of, I'm always really cautious about these kind of, women versus women, anti-solidarity discussions, because I think what comes up time and time in our research is that you can't assume who the advocate's going to be in the organisation. So a woman who has been through menopause may have sailed through menopause, and if she's your line manager, she might think, what on earth are you worried about, right? It could be that you have a young man who's your line manager who's had a significant other, such as a parent, go through menopause, who's kind of first-hand experience of seeing someone go through it, who's completely empathetic and very, kind of tooled up in his knowledge. So you can't assume who that advocate is going to be in the organisation. At the same time, we shouldn't be relying on people's personal experiences in order to support their professional roles. Okay, so we shouldn't be relying on that young manager's mum going through menopause and telling him all about it in order for him to be a better manager. We should be making sure that we supply that kind of training and education and awareness within the formal workplace setting.
It's clear that line managers have a really important role, and we're certainly seeing this in the psychosocial risk legislation here. I've looked at some studies in FIFO workers in Western Australia, and they were talking about the difference that a supportive versus non-supportive manager would make.
Yeah, absolutely. I mean, I think that's kind of, we know that, I mean, we find this repeatedly in the studies, to the extent it's kind of, now it's kind of almost boring to us because it always comes up in every study that we do, like line managers and supervisors, they just make a difference. And organizations in some ways, if they've got a limited amount of money, I would almost kind of say, and I'm backing a kind of, I'm backing a horse here in some ways, but, in some ways I would say, put that money into an infrastructure that supports your line managers rather than supports your employees directly, because they're the ones, if they feel supported and confident and being able to have those conversations and work through those accommodations, that's going to make the biggest impact to the workforce overall and to women overall.
I love the other point that you made about consulting the women in your organisation. I think, coming from a coaching background, I know that there are many people who want to fix people and assume that they know best, and they don't bother to consult the people that they're trying to fix. So I felt that that was a really important point that you raised too.
Yeah. I think, like, as I said, the answers will probably already be in people's organizations already. It's just that you might not have been, you might have been listening to them. So you might not have picked up on the cues. But, as you mentioned, Melanie, and I think Memphis mentioned this as well, we're not talking about forcing people. We're not wanting to force or out people in terms of their menopausal status because of those gendered ageism, stereotypes out there. But what we're saying is we want to create an environment where people can have those conversations as a kind of day-to-day experience, that it's not a big deal. And I think one of the best kind of examples was in one of the survey that we recently did, someone had talked about that they'd had a heavy menopausal bleed and they were wearing scrubs, so they were in healthcare, and said, what happened was, I was wearing scrubs. My colleague came up to me and said, "Oh, actually, your bleed, there's some blood showing. I've got a spare pair of scrubs that you can borrow, and I've also got some sanitary protection that you can use." And it was just dealt with. It wasn't a big deal. They just dealt with it. And wouldn't it be great if that could happen in all organizations without the kind of the fear of what we call leakage freakage, right? The fear of seeing blood, of like a natural bodily process, So I think, if we can get to that stage where it's not a big deal, then I think, look how far we'll have come if we get to that stage.
Absolutely. It's all about that understanding and compassion for others and support. I'm just going to the chat box here before we wrap up. Wonderful information and insights. Thank you, Kathleen. That's from Natalie. Tracy said economic vulnerability and the combination of age and gendered bias is really interesting. Thank you for shining a light on this. I can see that you've popped in the chat box a couple of links, Kat, to Menopause at Work and something else that I can't quite read, but that's okay.
That's okay. That's our amino study. That's the one that's just out last week that links to the national policy here in Scotland. So yeah.
And you've got also, oh yes, there's the amino study there. Fantastic. And Danielle has said often line managers don't receive the same level of any leadership training as more senior managers. Your recommendations for conversation, excellent, and Leadership 101 applicable to all people and situations. Thanks so much, Kat and Memphis. For anyone watching, we'll just field any last questions in the chat box. I've put a QR code on the screen if anyone wants to follow Sage Women's Health on LinkedIn, because we will be running more webinars like this. And I suppose some takeaways from me is we're really hearing that menopause affects all areas of a woman's life and livelihood. A lot of women are battling on. Some have no problems at all. But there are things that workplaces can do to keep women well and at work. And it's really around supports, cultural shifts, training and education, and particularly focusing on line managers, trying to normalize the conversation across the workforce. And I'd just like to thank everyone for being here on behalf of our team. We're really pleased that you're able to make it today. And if anyone's interested, we will be running a webinar at the early December. We've changed the date. It's the first week of December, 3 steps to navigating financial wellbeing for menopausal women in your organisation. Thanks everyone for coming. It's lovely to see you all. Lovely to meet you all. And we look forward to being in touch soon. Thanks, Kat and Memphis, for your time today.
Pleasure. Thanks for having us.